we are coming to the third installment of dealing with small penises and surgical method in order to enhance the penis. This week, we're dealing with one reader who was particularly concerned that in his youth or adolescence, he had the problems of phimosis. And he reckons that because he didn't solve the problem of the phimosis, the penis really suffered from no room for elongation. Therefore, perhaps he's a little bit compromised down below. Let's look into this problem of phimosis and perhaps the association with buried penis. So, what exactly is phimosis? In fact, it's physiological as a child up to year of 4 or 5 for them not being able to retract the foreskin. This is because there's a adherence between the glans penis and also the foreskin before the age of 4. However, as we progresses in life, that adhesions become slightly loosened and also the foreskin is meant to be retracted so that it can be cleaned properly. However, many men are way too shy into their adulthood and beyond and actually continue to live with phimosis. Imagine that for 30, 40 years of your life, you have not been able to retract the foreskin and always live with such restraint because the penis has no room to come forward. In reality, it shouldn't really shorten the penis. However, many men reckon that their penis is compromised in any way because it's buried backwards and no room for progression. Is phimosis problematic? Well, it's one of the rare medical conditions that you ought to do circumcision. It's problematic because it's simply non-hygienic. It's also problematic because when you have sex, it is extremely uncomfortable and painful. Sometimes it can crack and sometimes it can cause infection. More dangerously, phimosis may become paraphimosis because the tight band might get trapped underneath the gland penis and cause the penis to swell. And the worst case scenario, if it's not dealt with as an emergency, the blood supply to the penis will be compromised. It's a condition called ischemia. Sometimes it can even be gangrenous. There is no scientific evidence to suggest that circumcision or non-circumcisions that can help to prolong the size or the length of the penis. However, you can imagine that living with that restraint is problematic and perhaps he's right. That may reduce the length of his penis. On that note, if you're in your adolescent years or young adulthood, check your foreskin, see whether you can pull back. If you can't pull it back, you need a circumcision, and that freedom may ensure that in the future, you are not shortchanged in any way. When we advance into the month of April, then we are going to talk about circumcision. So what are the benefits of circumcision and what are the risks of circumcisions? If you're able to retract your foreskin, should you or should you not do a circumcision? And should all children be circumcised for the purpose of hygiene? So if you are contemplating circumcision for whatever reasons, or you're contemplating your child to undergo circumcision, you know you need to do that. You need to stay tuned and carry on putting Dr. G on the spot.